Welcome to Daily Series, COVID-19 Special. Dogs can be trained to sniff out COVID-19. We are just in the first steps, but they are obviously very intriguing. A researcher who has been training dogs to detect the novel coronavirus. Scientists around the world are working to enlist dogs in the fight against the pandemic. You walk into a hospital emergency room because you're concerned about mild COVID-19 symptoms, but instead of being greeted by a nurse wielding a nasal swab, you look into the face of a gentle German shepherd. The dog gives you a sniff inspection, and with that, you have your test results. Then envision dogs providing the same kind of sniff tests in other places: office lobbies, warehouse entrances, sports stadiums, malls, and concerts. The use of trained dogs to detect the coronavirus may sound like science fiction, but it's already happening. Finnish researchers launched a pilot study involving 4 COVID-19 dogs at the Helsinki airport. Arriving international passengers are asked to rub their skin with a special wipe, which is then placed in a beaker next to other containers of different control scents. With a few sniffs, the dogs are able to identify infected passengers, even those who are asymptomatic, with close to perfect accuracy. Researchers around the world are working on similar projects. We're just in the first steps, but they're obviously very intriguing. Published results of a small study on COVID-19 detection in dogs in July. It's exciting to think this could be an option for COVID detection. Canine coronavirus team in training. Trained 8 dogs from Germany's armed forces to distinguish between saliva from patients with COVID-19 and saliva from a control group. Then they got samples from 1,000 people and tested the dogs to see whether they could identify those with the coronavirus. The dogs could, with 94% accuracy. Another small study involving 9 dogs from the University of Pennsylvania School of Veterinary Medicine in Philadelphia used urine samples from patients with COVID-19. Researchers found that dogs could detect the coronavirus with 95% accuracy. The results suggest that dogs are performing so well at ignoring COVID-negative samples that we're moving into communications to phase 2 would involve testing saliva from hospitalized patients who tested positive for COVID-19. A similar effort is ongoing at the London School of Hygiene and Tropical Medicine by the same team of researchers who discovered that dogs can identify patients with malaria by smell. Those scientists are currently preparing a 6-week training course for dogs to sniff out positive COVID-19 cases, with the goal of training a single canine to screen up to 250 people per hour. What kind of smell does COVID-19 give off? Like other diseases, COVID-19 changes the metabolic processes of cells in the body, triggering the release of a signature scent that dogs are able to identify. If you're not infected with the virus, your cells won't have the pathogen-specific odor that may be associated with COVID-19, so trained dogs pass you by. It's possible that one day researchers could develop electronic dog noses, which Volk says would be far more accurate than quick tests like temperature readings, a method that has limited effectiveness, since not everyone infected with the coronavirus has a fever. A future of doggy detectives compared patient asymptomatic with symptomatic patients, and how specific the scent signature is in comparison to other respiratory diseases. As the field of canine COVID research continues to evolve, a future of infectious disease doggy detectives might not be that far off. Can you get coronavirus from your pet? What we know and what we're still learning about the risk of transmission between humans, cats, and dogs, plus expert guidance on how to keep your 4-legged friends healthy. Coronavirus worries have led some pet owners to buy masks for their dogs. Most of us have heard the experts' advice on how to minimize the human-to-human spread of COVID-19, starting with, wash your hands some more, don't touch your face, stay home as much as you can, wear a cloth face covering when you go out, and limit your exposure to anyone who is sick or who may have been exposed. But what should we do about our cats and dogs? Since the pandemic began, a handful of pets in Hong Kong, Belgium, and New York State, as well as 8 lions and tigers at the Bronx Zoo in New York City, have tested positive for SARS-CoV-2. Most recently, a pug in North Carolina made headlines when it tested positive for the new coronavirus, according to an article published April 29 by WRAL.com. The pug belongs to a family that was taking part in a Duke University study in which the parents, both doctors, and son all tested positive for the coronavirus. One daughter, another dog, and a cat also live in the household and didn't test positive for COVID-19. The pug experienced mild symptoms like coughing and sneezing and didn't want to eat his breakfast but seemed to recover after a few days, according to the family. All of this may have you wondering about the risks of human to animal and animal to human transmission. Read on to find out what precautions experts recommend to keep you and your pets healthy. Get the coronavirus, would it have symptoms? According to the World Organization of Animal Health, OI, the pets who tested positive for the coronavirus became infected through close contact with caregivers who had COVID-19. The OI considers these to be isolated cases. Based on everything we know so far, it seems that coronavirus infections of pets are very uncommon, even though they can occur. WHO specializes in infectious diseases of dogs and cats. We know that cats and dogs can be infected without showing signs, and it seems that sometimes infections may be associated with mild respiratory signs such as cough, increased respiratory rate, or gastrointestinal signs like decreased appetite. If your pet develops new signs of respiratory or gastrointestinal illness, it's much more likely to be a dog or cat disease that is not COVID-19. However, if you or someone in your household was recently diagnosed or suspected to have COVID-19, there is a chance that your pet could also have the disease if it develops similar signs within a few weeks of your diagnosis. Can a pet infected with the coronavirus pass it on to people? The OI and the Centers for Disease Control and Prevention, CDC, stress that there is currently no evidence that pets can spread the coronavirus to people. Consider the case of the first pet that tested positive for the coronavirus, a dog in Hong Kong, a situation detailed in a March 4 press release. According to the Hong Kong authorities, the infected dog appeared to be shedding low levels of the virus. While that might seem to pose a risk of transmission to humans, it is unusual for coronaviruses to jump species in this way. Public health and infectious disease authorities agree that transmission of COVID-19 relies on person-to-person interactions. Even though we know dogs and cats can get infected, they may not be able to shed enough virus, or shed in a way that promotes transmission to people. People who must interact with pets from households known to have COVID-19. Are any types of pets more vulnerable to the coronavirus than others? In a study published on April 8, 2020, in the journal Science, researchers in China who deliberately exposed a small number of animals to high levels of SARS-CoV-2 concluded that cats were more susceptible to the virus and COVID-19 than other species under investigation. The researchers found that ferrets were as likely to become infected by the virus as cats, but were less vulnerable to COVID-19, and that dogs were less affected than either cats or ferrets. We still don't have enough information to say whether cats or dogs are more susceptible to the virus. There's been too few animals out there, in the real world to say, and although experimental infections performed in China suggested that cats and ferrets were more susceptible than dogs, there were very few animals in that study of limited breed and age. The findings of that study may not translate well to the real world. Should my pet wear a face mask when we go outside? The CDC recommends that people wear cloth face coverings in public places where social distancing isn't possible, especially in COVID-19 hotspots. The purpose is not so much to protect the person wearing the covering as it is to prevent an infected person, including those who are asymptomatic, from transmitting the virus to others through respiratory droplets emitted while talking, coughing, or sneezing. But this recommendation to wear face coverings does not apply to dogs or cats. There is no evidence that pets can spread SARS-CoV-2, and these masks are typically ill-fitting and not tolerated well by pets. What should I do to keep my pet safe? Research on transmission involving animals is just beginning. The following precautions to keep dogs and cats safe. Don't let pets interact with people or animals outside the household. Keep cats indoors to ensure they don't interact with other animals or people. Walk dogs on a leash, keeping them at least 6 feet away from other animals or people. Stay away from dog parks or other public places where groups of people and animals gather. During the pandemic, always walk your dog on a short leash, and do not allow others to approach and pet your dog, mostly because close proximity increases the risk of human-to-human transmission. The OI also recommends that animals of pet owners with COVID-19 be kept indoors as much as possible. Can I still snuggle with my pet if I get sick? If you have COVID-19, or are suspected to have it, you should wear a mask and minimize interactions with your pet. She also recommends that you quarantine your pet in the household with you. Someone else in the household should ideally take care of your pet, and they should wear a mask and eye protection when they need to take care of the animal, just to be on the safe side. And you should not share food or utensils with your pet or allow it to sleep in the bed with you. You should also practice frequent hand hygiene, she adds. If you don't have COVID-19, then you can interact with your pet normally and enjoy all the benefits of the human-animal bond. No matter what, it's always a good idea to wash your hands properly after feeding or playing with your pet. Also, as a general rule, it's never a good idea to let your dog lick your face or any wounds you may have, and that's especially true if you're immunocompromised. Immunocompromised people should also refrain from sleeping in bed with their pets. If you like this video, don't forget to like and hit subscribe. Thanks for watching. See you on my next video.